8. The subject is antidepressants. Are antidepressants necessary to treat depressive symptoms? Depression is complex and involves many components and different treatment strategies. An individual may be provided the option to be provided antidepressants to treat depressive symptoms by either a physician or mental health professional. However, an individual may be provided other options in treating depression. What becomes debatable is when antidepressants are necessary and to what extent they are beneficial for the consumer. Many individuals may have tried many avenues of recovery interventions before being prescribed antidepressants. However, what is the most suitable recovery intervention is oftentimes dependent on the individual situation. A controversy remains on whether antidepressants are overprescribed and when antidepressants are necessary to be provided for treatment intervention. Also, another debate is whether placebos are as effective as antidepressants. Antidepressants may be the most beneficial combined with psychotherapy. When an individual is recovering from substance dependency, depression may be a symptom of a negative emotional state. If an individual does not address the depression combined with psychotherapy, the individual may experience depressive symptoms after an extended period of time. When an individual is recovering from substance dependency, the individual may experience complications with sleeping patterns, feelings of suicidal ideation, weight, and change in eating habits. Individuals who are in the recovery process for overcoming substance dependency are at a greater risk of experiencing comorbidity and depression. An individual may provide the most benefit in being provided antidepressants for the recovery process and substance dependency as well as receive psychotherapy services. Antidepressants aid in restoring memory, pain management, and emotional regulation. An individual may experience feelings of low self-compassion, decreased energy levels, and feelings of hopelessness, which may be addressed through antidepressants combined with psychotherapy. Antidepressants aid individuals in restoring memory recognition and provide feelings of ease for individuals who had experienced a stroke. Some antidepressants may aid an individual in pain management. Antidepressants are most effective than placebos in reducing physical and emotional pain symptoms. Antidepressants aid in the individual's mood condition. Psychotherapy services may aid an individual through slow recovery growth, and antidepressants may be necessary to increase the progression of overcoming feelings of depression. And antidepressants may relieve symptoms of emotional despair and insomnia. Some individuals who experience insomnia may have tried different psychotherapy interventions. However, antidepressants may aid the individual in developing deeper sleeping patterns. Having effective therapy may be costly for some individuals, and many medical plans may not cover therapy services. Some individuals who are experiencing depression may also struggle with self-motivation, and insomnia does not help with an individual's level of motivation. An individual who is experiencing depression may be struggling emotionally for years with feelings of suicidal ideation and feelings of hopelessness. Antidepressants may relieve individuals from a negative emotional state of mind. Antidepressants are effective in treating acute depressive episodes. Individuals who are in an acute state of depression have experienced benefits from the consumption of antidepressants and have shown benefits over the consumption of antidepressants during mild depressive episodes. Antidepressants are effective for individuals who experience mild depression as well as severe depression. Being able to be provided a full range of treatment interventions would provide the most benefit for addressing suicidal tendencies and to be provided interventions for a hopeless state of mind. An individual who experiences intense levels of depression has shown stronger response rates than individuals who are consuming placebos. The effects of antidepressants may be immensely effective for some individuals. Medication may provide insight during psychotherapy interventions. When an individual engages in cognitive behavioral therapy, an individual may be able to have a more relaxed state of mind while the individual is consuming antidepressant medications. An individual's concentration levels may also increase after being administered medications. The individual may be able to address mental health conditions while on antidepressants and be able to be more receptive of insight that is acquired through psychotherapy sessions. The individual may be able to relieve some depressive symptoms after the consumption of antidepressants. An individual may have an increased level of self-esteem from the consumption of antidepressants. An individual may be more inclined to seek out psychotherapy services after being administered medication. Social and economic factors impact depressive symptoms, and medication may aid with symptoms. Within the United States, there are many activities that an individual may become involved with. An individual may be seeking a quick fix for what the individual is experiencing, and being able to address psychotherapy and medication interventions may be the most effective remedy. Medications is one way of producing action for helping individuals reach their goals. Individuals may consume antidepressant generics at a less expensive cost than to be provided psychotherapy interventions. An individual may also have a hectic schedule and work life, so antidepressants may be an answer for some individuals who are seeking out immediate relief for depressive symptoms. An individual's adverse experiences need further examination for understanding depressive symptoms. When animal models of research for depression have been conducted in experimentation processes, most experimentations are measuring stress levels of the animals, not the depressive symptoms. Over half of individuals may not receive the full benefits from antidepressants due to the drug addressing stressful response systems and not depressive symptoms. The reason that most antidepressants are ineffective is due to aiming to stimulate neurotransmitters of the brain. However, depression occurs further up in the areas in the brain processing system. The chemistry of depressive symptoms actually begin in the functioning levels of the neurons themselves and the development of the neuron. Medications have been focused on the effects of the medication and not the causes for depression, and why some individuals may not receive the full benefit for the antidepressant medication. It is of critical importance to determine the reasoning behind why antidepressants are not effective for so many individuals. Some individuals consume antidepressants in order to avoid stressful life events. There are a multitude number of individuals who consume antidepressants in order to escape from stressful life situations. The individual consumes the antidepressant in order to numb out and escape from reality. Physicians and psychiatrists overprescribe antidepressants as a way to provide interventions for individuals who are experiencing hardships. Some individuals may be experiencing marriage difficulties, experiencing complications in the individual's career. Some consumers of antidepressants desire immediate and quick fixes to their problems, and antidepressants may appear as a solution. However, without addressing the individual's life experience, the individual may only be looking for a quick remedy for emotional pain relief symptoms. Antidepressants may increase the possibility of developing seizures and epilepsy. For individuals who are 65 and older, numerous categories of antidepressants have been associated with a greater risk for the development of seizures and epilepsy. The risk for developing epilepsy will need to be fully considered and investigated if the individual desires to be a consumer of antidepressants. The individual's long-term recovery will also need to be considered due to antidepressants may be more beneficial for short-term consumption. The individual will need to take into account their circumstances and if adding risk for developing physical and mental health conditions is worth the risk of the consumption of antidepressant medications. The Federal Drug Administration may administer a black box warning for categories of antidepressants. Once an individual develops a tolerance for antidepressants over time, an individual can have a difficult time abstaining from antidepressants and may become dependent on them. Some of the black box warnings come with a notification that an individual may develop feelings of suicidal ideation while consuming the antidepressant. The individual can be consuming antidepressants instead of discovering the emotional, spiritual, and physical reasons for experiencing depression. Antidepressants may cause a number of negative side effects, such as experiencing hallucinations, panic attacks, violent behavior, and increased self-harm. Some individuals experience extreme negative outcomes from consuming antidepressants. A few individuals have had tremendous negative experiences from consuming antidepressants. Some individuals have experienced feelings of disorientation and increased level of anxiety. A few individuals may experience irritability and suicidal ideation. Some individuals experience headaches and dizziness. A few individuals may also experience serotonin syndrome, which may lead to seizures, unconsciousness, and an abnormal heart rate. When an individual tries abstaining or tapering off the antidepressants, some individuals may also experience negative side effects and a feeling of hopelessness. Some individuals develop insomnia and experience other negative physical sensations. Individuals may require more intervention when being administered antidepressants. An individual may have different reactions while using antidepressants, depending upon personality factors and co-occurring conditions. However, interventions may be needed to address the individual's personal situation. An individual may experience different reactions to antidepressants, such as some individuals may experience benefits from antidepressants and some individuals may experience an increased risk of suicidal ideation. It is of critical importance to monitor each patient through the recovery process, especially when first administering antidepressant medications, in order to reduce risk factors. Providing inpatient interventions may be the most beneficial options for individuals who appear to be more high risk for acute depressive symptoms. Antidepressants have many negative side effects which should be noted by a psychiatrist or physician when prescribing antidepressant medications. Antidepressants may be beneficial for some patients. However, for some patients, antidepressants may be more problematic than beneficial. It is of critical importance that the patient is provided education towards various options of recovery from depression. When an individual is informed from the psychiatrist or physician about the potential side effects of antidepressants, the patient will be able to make a more informed decision on which approach may be the most beneficial for the client's lifestyle. An individual may be searching for a quick fix for emotional and physical pain relief and may not consider all of their options before being prescribed antidepressants. An individual may experience various negative emotional mood conditions and may not be open to psychotherapy interventions. Combining psychotherapy interventions and medical interventions may be the most successful treatment strategy for a multitude number of patients. An estimated 1 in every 10 individuals are prescribed antidepressants, and many of these individuals are not utilizing the multitude number of psychotherapy services that are available. An individual may try to numb out from the negative emotional experiences, and using antidepressants may be a coping mechanism for what an individual is experiencing. So there may be many negative experiences that an individual may have, and antidepressants may be the first way or the first thing that an individual becomes involved with instead of addressing their emotional, physical, and spiritual wellness, as well as the different dimensions of wellness. And the opinions are, it is of critical importance that an individual researches various methods for overcoming depression before being prescribed antidepressants. Physicians don't always have the available time to meet with patients who are experiencing depressive symptoms, and therefore many patients are prescribed medications even though there are more beneficial ways in addressing depressive symptoms that may be addressed in more natural methods. Individuals who believe they are experiencing depression may be experiencing stressful life experiences, and there may be more beneficial coping mechanisms such as consuming amino acids, meditating, and exercising. Individuals may also need to become more proactive in developing individual life decisions and choices. Also, psychotherapy interventions may need to be provided for more mild cases of depression. Antidepressants may become addictive for some individuals, so it is of critical importance to determine the risks associated with consuming antidepressants. Various methods will need to be approached first before being prescribed antidepressants, such as addressing the 8 dimensions of health and wellness. Doctors should be informed on various risk factors of depression, as well as educated on substance dependency and comorbidity conditions. Youth are at an increased risk for suicide ideation while consuming antidepressants. It is of critical importance to determine the use environment and peer influences before being prescribed antidepressants. So there are various factors to take into consideration when determining the success rate of antidepressants and what antidepressants can help an individual with. If an individual does not discover all the different types of interventions that are offered to them first, and instead go towards going in antidepressants, then it can become a problematic situation, especially when it comes to different co-occurring conditions, and when an individual is basically substance dependent on various substances, then different effects can be made within the brain functioning levels and various changes. So basically my references, it addresses what the extreme sides are of antidepressants, such as limited ability for cognitive functioning levels, motor cognitions. Some individuals experience delusions and other things like that. And then there's experiences of cognitive behavioral therapy combined with medications, and there's just different options of how antidepressants are overprescribed, and the effects of antidepressants, suicidality, definitely a lot of things